Hello to everyone. We are going to start this event focusing on migration. This is part of collaboration of Junction, and Junction is this public venue here focusing on Southeast Asia with IPSR, Institute for Population and Social Research of Maidon University. And we have already started since last year a collaboration focusing on mobilities in Southeast Asia. We have had 6 events, and this is now the 7th event, and we are very proud to have here a speaker from Israel who is going to talk about the well-being, particularly the well-being as far as I understand, and the psychological situation of Thai migrants in Israel. So a very interesting topic. Yahel Kurlander, I am sorry if I misspell. I think she's going to give us the findings of her research, and then we will have also time for question and answer. I want also to introduce my colleague, Dada, here in front, Jan Musika Wong, and she is collaborating with us on this initiative. And my name is Pia Shortino, and I am the director and founder of Junction, and also working at IPSR. So please, without further ado, is from Tel Aviv Academic College in Israel.
Thank you so much. I would prefer to stand. PowerPoint? How do I do it? Just click it? Okay. So 2 years ago, I gave a lecture to IPSR, and it was just I think a month after this horrible death of 2 migrant workers in Israel from unnecessary death from the Israeli-Palestinian conflict, never-ending conflict of the Palestinians in Israel. And this death was a shock to me, and I have to say that I thought and I wrote and I was trying to publicize as well in the parliament and also in the newspaper against the death of workers because the lack of shelters in a bombing situation during the conflict. I don't know if you know, but Israel has some areas who are more likely to have rockets inside, and this is one area. And as you can see here, I was translating it to English, one of the reporters said that this was like a known tragedy because the accommodation was lacking shelters, and the shelters was not in the satisfying conditions. And I'm starting with that because, not because, I'm sorry, it's still hard for me to understand that nothing has been done to correct that. For now I know that there is still no one hurt from a rocket, but I know there are already 3 other Thai workers injured, one of them severe, but nothing has been done about the shelters. I mean, after this accident, they put some shelters in the area, but they took it back after the conflict time was over. But once in a while, it happens again. And I want to talk about health, physical and mental health. But this is about the end of life. It's about death. It's the ultimate circumstances that someone comes to Israel to work and do not come back. And there's another circumstances. Maybe I will take it a little bit even harder than that. I don't want to do hierarchy, actually. All deaths are horrible. But this is a cause of a psychotic event. And I want to tell you that in the middle of the night, I received a phone call from a recruitment company. Like it's not a recruitment company anymore, it's a human employment company. And the woman who talked to me says, I have this Thai worker, he's in his caravan, he's in his accommodation, and he's listening to music, loud trance music, and shouting and throwing things. And I said, like, yes, let's call an ambulance. It's a psychiatric ambulance, psychiatric ambulance. And yes, they call it because this person had insurance. And the insurance company sent an ambulance, but they called the translator to ask him, are you on drugs? Are you on drugs? And this person told them, yes, of course I am. They do quite a lot of drugs, yaba mostly. You know yaba? Yeah, it's tina or crystal meth at night. And then the ambulance, the people from the company, from the health company said, okay, this is out of our limit because it's not under the conditions of your health insurance. If you're doing drugs and something happened to you, we are not responsible. So the ambulance, the second time actually, just go around. And you can see here how they explain to us in an email why they did not give him the treatment. And this person, by morning, was dead because he was in his psychotic event, burning himself in this accommodation. I don't know, it's a caravan, it's made of wool. My daughter is here and they are shocked. I'm sorry still about this situation. It's so horrible for me to understand that people, healthy people, young people come to work, and Israel wants workers to come to help, and they come to this situation of psychotic event with nothing I can do. I'm still not over that, and I'm sorry, it's in Hebrew, I will explain to you. This is data that took me a lot of time to get from Israel. It's about death due to trauma, and this is suicide. Two suicides in 2015. I mean, in conclusion, we have 44 deaths out of trauma, but this is suicide, this is car accident, suicide. This is burning. This person is here. It's not burning, it's suicide, it's a psychotic event. I cannot say it, but you understand what I mean. This is an event which is not burning. I just my electric thing fall down, but no, this is a psychotic event and this is a suicide. Here it's a work accident, this is a suspicion of murder, this is a suspicion of murder, and that's the 2 rocket bombs that I started with. This is a situation I cannot stand. I know I'm an academic, I'm a professor, and I have a position, thank God, in the university, and I'm supposed to be like cold to the data, but I'm a qualitative researcher, and I cannot stand to these issues and be objective. I don't believe in that. I mean, I think qualitative people do not believe in objectivity, and I believe in activism to do research and to try to help other workers. And just before I came here, me and my girls, we went to the village to a family that I'm in touch for more than 20 years, and we talked about a lot of things. But one of the things that this person keep on saying to me, and she's told me that once again, she says, you know, Yahel, only Thai workers understand Thai workers. I know you are smart. She goes like, yeah, I know you're a professor, and you're smart and everything, but I don't think that you understand us. And she's absolutely right. And I'm now doing a big research about health. I finished one data collective and survey with those NGOs, Workers Hotline, and Physicians for Human Rights. But we're continuing in a research about health, mainly about well-being and mentally health, but not only. And I want to say that one of the reasons that I'm here now is because I am looking for someone to work from here, from Thailand, because only Thai people can understand Thai people, I think, in general. I have so much limits about understanding, but I do understand farmers, and I do understand Israeli legislation, and I think that we can try. Israel is at a big mess now, politically. My saying, it's a big mess now, and I don't see a lot of help from the politicians and stuff, but I think I continue of trying to do good things for the workers who come to Israel. So this is my goal, to seek for colleagues and to seek for ideas of collaboration, because I want to expand my research about health, because I see it as a huge issue for the Thai workers. So, okay, that was like a start. I'm sorry, I want to say that. Can I go back? Yes, I can. After this, big introduction, my name is Yahel, and I'm a professor in Tel Hai University College. And everything that I want to say now today is from an article which is based on a report from the NGO with my colleagues, Dr. Zoe Gottsweit from Physicians and Michal Tajer from Kavla Oved. Actually, you took the picture from our report. And yeah, and I'm the head of the sociology and anthropology department in Tel Hai. I'm a sociologist. I'm a sociologist of labor markets, specialized in labor migration. That's me. That's my girls. Come to me. Come with mama to research. So, I don't know if you know anything about migrant workers in Israel. I'm just going to say a few words. This is actually the wall between the West Bank, Palestine, and Israel, beginning with the rockets. So actually, some of the workers work very, very close to the area where the Palestinians, the people who work next to the wall are actually quite safe, I have to say, to be with that way. Okay, so this is a documentary temporary migrant program. So all migrant workers, Thai migrant workers who are coming to Israel are coming legally. It's a documented, wanted, more than 40 years from the 80s to come to Israel for the agriculture sector. I have to say now, I'm from a farm, my father is a farmer. We employ Thai workers actually. I remember this family that I come in Thailand. She's working also. She wanted to say she works also in the farm. What I want to say, this family is working with my in the farm with my father 20 years ago, and when they left, I stayed in touch. So all of them came legally, and Israeli agriculture is essential to the Thai workers. Without Thai workers, without migrant workers, there are no Israeli agriculture today. It's a little bit less than half of the workers are Thai workers, which is a lot. The other are Palestinians from the West Bank coming daily commute, and some Arab citizens of Israel, and of course Jewish Israelis. Those the division. It's 25,000, 26,000. In general, in Israel, there are three main labor migration occupation: agriculture, construction, and nursing home care. But now it's also about hospitality, cleaning, and bellboys, stuff like that. And after 2012, June 2012, all Thai workers coming under a bilateral agreement. For now, I think, I don't have a data which contradicted, it works. Before 2012, they paid $10,000 to come to Israel. Now, as far as I know, I want to do another survey, but as far as I know, they don't. They pay $2,500, which is a lot less. But they have other problems. Okay, so this is about general, and specifically about the Thai workers. They work in the rural areas of Israeli countrysides, periphery. We're talking about settlements, small settlements like the one I come from, which is next to the border in Lebanon, in the north. So it's a physical and social isolation. It's not next to the cities. Like, it's not about Bangkok City, right? But Tel Aviv is still a city, an international city. No Thai workers in Tel Aviv. They're all in the settlements, far from there. It's from the north, it's 2.5 hours, and from the south, it can be 3, 4, and 5 hours, which is a lot in Israeli means, because public transportation do not happen in Saturdays when the time is off. Saturdays is the day off, and there are no public transportation at all. So it's not like they can go to the city in their free time. We know that employer supervision extends all aspects of their lives because the workers, the Thai workers, live in the backyard. I have actually one of my articles says employees in the backyard, because it's in the farm of the employee where they have this accommodation together, like 10, 15, sometimes all from the same settlements, and sometimes for one employer. And the visas is for 63 months. Some of the workers stay longer. It happens sometimes, but usually it's not considered a problem of illegally, because they go out after 17 months or something like that, but they don't overstay. When Israel talked about the problem of illegal workers, it's never about the Thai. It's about the Philippines, it's about the Chinese sometimes from the construction, it's never about the Thai. And we're talking, this is not correct, it's now 25,000, and very less women. Before the bilateral agreement it was 10%, now we're talking about 3%. Why? It's different, totally different lecture. So now it's almost no women in the sector. Okay, so let's talk a little bit about health insurance. All citizens of Israel have health insurance from companies, from 4 companies. Quite extent, I have to say. Israeli health insurance is mandatory. It's mostly free of charge, and all workers are excluded from the state health insurance law. But they do have another law, the Foreign Workers Law, which obligated the employee to give them a private one. And since they all came legally, and all of them came legally, they all got, their first employer, their private health insurance, 100%. If they change employer, they change their employer, and they did it not legally, they can lose. And as I will show you, they have no idea whether they have the insurance or don't. So this is the problem. But all of them, the moment they arrive to Israel, they have a private insurance, limited basket of services, but still. All the main issues for women as well, gynecologists and everything, they have the main issues covered. And so they have it, and actually they can go to the same clinic that all citizens go. In every settlement, I put a map. I told you they live in the rural areas. This is the rural areas of my area, the north. You can see, this is Lebanon already. Okay, this is where I live. Where do I live? Over here, somewhere over here. Oh, it is. That's my village. But you can see all the small villages, but you have clinics in everyone, almost in everyone. And if not in this settlement, in another one which is like 10 minutes away. So actually they do have clinic services in every settlements, but they will not go. I will tell you in a moment. So the accessibility is happening, and also we have the patient right law in cases of emergency. So I told you that they can lose their insurance if they are not legally, but if they are in a car accident, if something happened, or work accident, we have in Israel the patient right law, which means that any medical emergency is covered by the state. This is one of my problems with the other psychotic event, and I thought it was under this law they're supposed to have. But as you can understand, the ambulance did not thought about that. Did not thought that this law was applied. And I have to say that for a few, because my name is quite known in this area of Thai workers, I get calls. And it was a year ago, I think, that he had a problem with sugar, I don't know how to say it, diabetes, dyslexic, one of the workers, and it's covered by a limit, by the insurance, and he had a little bit problem, like a seizure, and he went to with the employers, actually, with his employer, went to the hospital, and the people in the hospital did not receive him. They said, your insurance is not covering you that. So what we did, I'm actually quite ashamed to say it, but what we did is we called the spokesperson of this hospital and we told him, why is your people do not allow people in distress to get medical services? You have the patient rights law. After that, we will argue whether it's covered or not covered. But this is a person in a seizure. You have to take it. We did, but it's only because we are threatening him with newspaper, with bad publicity or something like that. This is one of the solutions, which horrible, of course. Okay. And okay, a little bit theoretically, because I am from the university. When we talk, I'm going a little bit aside because I'm stepping into the problems and stepping into the issues that I will consider them. I will gonna say that I think that some of those problems we can see it even as human trafficking, as someone who's in such a severe condition, horrible conditions of health, it's almost in the areas of human trafficking, which, in the spectrum. This is what I want to say. It's according to Yahel Kurlander labor approach. And when we talk about understanding of human trafficking, the conventional understanding, that it's two different words, okay, worlds. One is the human trafficking, force, fraud, everything like that, and the other is the labor market. And those people, the time workers, are, in the labor market, right? They came legally, they have a law which cover them, they have a kind of contracts, they consented to come to Israel, they can change employers. So in the conventional understanding, we do not see them at all in the area of human trafficking because we don't have like force and we don't have all those issues. But in the labor approach, thought and conducted by Professor Hila Shamir, perfect Hila Shamir, if I may add, somebody who knows her, she knows how wonderful she is, a professor. We're talking actually about the spectrum of commodification, a spectrum of commodification and denying rights. And when we think about that, we're talking about unfreedom, will and unfreedom, and the idea of decent work. And those questions of consent and choice and control are a little bit in the spectrum of the question about your bargaining power. And it's a question about how do they treat you as a commodity or not. And when I think about this approach and I look at the conditions, and I'm just going to state them, I think that we are going on this spectrum a little bit more and more through here. It's not that I read the literature. I know there are horrible, horrible cases which are 100% human trafficking. And I know there are, decent work. But I can say as well that I'm very, very upset about the conditions of time workers and about the way that their work and living conditions can bring them almost to those areas, and we have to treat them differently. So just to say what my data is based on, and it's based on a report that the NGOs wrote, and I only worked there as a consultant, as a professional who helped to make the surveys and talk about the literature and stuff like that. And after they finished the report, I thought, okay, let's make an article out of it, and let's try to make a big research issue. That's what I'm starting now. So actually, we join hands. This is something I really, really do believe in, to try to join hands with NGOs, with people from the field, and with researchers in the university. And it's based about 4 surveys that we conducted during those times. One was about working living conditions. It was online, in the Facebook group of Thai workers. They have line groups, like WhatsApp line groups, and they have the Facebook one. And the Facebook is run by the NGO, by Pablo Over. And we put those surveys in the Facebook groups. And one was specifically about health, about working conditions during conflict survey, about the rocket, and also about safety. Okay. No, I didn't want them to end. Sorry. It's like my first time, right? No. Okay. So when I came to one of those women, Michal, actually, and I told her, okay, we did a survey and we know the data. Let's make an article of it. Let's talk about the right to be healthy and about how they denied from health. And she says, like, what? What do you want to do? No, we cannot talk about the health of Thai workers because the essence of the right to be ill is denied from them. And I said, like, what? What do you mean? And she says, let's come. You didn't understand the data. She was like, you didn't understand what was concluded from our data. And I said, like, oh, what do you mean? And she says, they cannot be ill. They're not allowed to be ill. And this is what I understand here. Nearly 50% of the employees testified that they continued to work while they were sick. That's denying of their free will of not going to work, to feel ill and to be in bed and get treatment for the disease. We're talking about those percent which were a little bit not conclude. They did not receive proper payment for the days they were sick. And if you don't get paid, you choose to continue work. You have to work. You need to send your money back. There's a lot of pressure for you to go to work. So when we are talking about health and illness, this is one issue out of it. No, so let's talk about the health insurance. This is a very good thing. It's very important because they're legal, because they are a documented program. But when I look at the data, I understand that they have no idea whether they have. You will look at the data, but I mean about the figures. But I will say the conclusion is that most of them didn't read the contract. I mean, the one that they sign about their health insurance contract card. They do not know whether they have the card. They do not know where to go. I mean, they have in every settlement we have. In every settlement, the clinic. But the workers do not have the card to go there. They do not speak, of course, Hebrew. They do not speak English, okay? Most of them, I mean. So how can they go there? How can they get the treatment? And I'm talking about, they didn't know which health insurance they have. They said the employer holds the health insurance, so he holds the health insurance, but they don't get paid for their illness. How will they go to the doctor and lose more days? It's like a problem just continuing. Never received the health insurance card. They do possess 50%. 43% they had a problem and experiencing of getting a medical service. Google Translate is great, really. I know because now when we went to the village, the translator, the interpreter was just ditching me out and did not show up. Okay, I'm a qualitative person, I didn't mind. I will just go along and observe and talk in they have some Hebrew, some English, and we had Google Translate, so it's okay. But it's not okay when we are talking about medical circumstances and about medical treatment. How do I understand specifically what I need to do with the medicine? How do I understand? How can I explain specifically what happens to me? So no interpreter. The only interpreter are in the head of the recruitment company. Okay, they have no interest. I mean, they do have some interest because if it's a good employee, he will want them to be better. But it's one person over like 500, 700 people. Will he answer? Will he not answer? How it will work? So it's a problem. 80% never have seen or don't know their health insurance conditions. And it's not, I didn't say nothing about gender, but we saw that all issues of women is treated through private connections with Thai women who are living in Israel, with birth control sent from Thailand, and with abortion being held in Israel in official ways. But that was about the insurance. Okay. But it's not only about the insurance and about being, sick now. I mean, my daughter had a flu or something. She had a fever. I canceled the meeting. Okay, this is about being sick. She just stayed in bed. I gave her some meds that I brought from Israel, and that's it. But we were in a hotel in Bangkok with water, from buying from 7-Eleven, with great food, with everything. Everything was wonderful. After one day, she was better. But we're talking about health-defining conditions. What about the environment of a young person coming to Israel, wanting to do his 5 years of work, and doesn't have insufficient access to drinking water? I want to talk about this line for now. Israel is in the OECD countries. Israel is an industrial, modern, whatever country. We're talking about settlements of citizens of Israel, Jewish and Arabs. How come they do not have access to drinking water? When I saw this data, I was like, how is it happening? How? I mean, I've been to almost all settlements of Israel where Thai workers live. All of them have drinking water. The system works everywhere. How does it happen? Does anybody have an idea? Oh, that's a question. Question there. My daughter, do you know? Did I tell you? Oh my God, she's so good. She is a farmer. She works in the farm, so she knows. She said in Hebrew because they live in the rural area of the farm. This is absolutely right. One of the regulations, you read my articles, one of the regulations apply because they are temporary workers, temporary people, whatever that means, of course. They can live in temporary accommodation, and temporary accommodation can be set in the agriculture area, which is not the place of the house. All houses have to, when you build a house in Israel, you have to get authorized, accept that, and you get permission, and you have to be connected to the line of the water. Water and also sink and everything. But if you put an accommodation in the middle of the field, which is absolutely formal and okay and legal, there you go, without access to drinking water. In Israel, in the green line of Israel, in citizens of Israel, it's an amazing figure. I'm still not enough with that. And I have to say that I'm trying, together with a group of Hila Shamir Traffic, try to fight this kind of issue of water regulation, just to put an accommodation in the middle of the field, in the middle of the mountain. It's hill sometimes. Okay, and you can see all other issues. I have this quote here about being crowded and about the drinking water smells bad, and you can see without a bed, without a refrigerator, without a cooler. Most of the workers, actually, most of them works in the desert, in the Arava, which is in the, I think IPSR was already invited, Dr. Matan Kaminer, he speaks about it quite a lot. It's in the desert, it's so hot. It's hot all over Israel. But in the Arava, it's extremely hot. How can you be in accommodation without a cooler? It's not possible. Without a bed, without a place to eat. And this is about the surrounding of health. So when I look at those, just a few tips of data, which I try to just get teaser for you, I think that for over 40 years, nothing is temporary here. It's more than 40 years. People come. It's not a new thing. You're just getting it organized. No, this is a lot of years. And we're talking about harsh conditions, working conditions, and horrible living circumstances. And those issues are violation of the fundamental right of people of health, which bring them as well of mental health problems. Okay? And I think when I was like, why do people use drugs? This is a question. I'm sorry for this naive question. I know why people doing drugs in parties. Okay, I get it, maybe. But why do they do quite a lot of drugs when they are young? They come to work, they need to send money back home. They see people going psychotic, they still do it. And when I understand the circumstances of those harsh conditions and loneliness and away from home, together, maybe I can understand how they get to those circumstances. And they absolutely not fault saying, of course. But I think maybe we talk, if we start to talk in ways about labor approach to human trafficking, which makes the spectrum of human trafficking, and to treat those conditions, we can benefit the health, the well-being, and physical health of workers. Thank you so much. If you want, I am a researcher, so few articles. And as I said before, only Thai people can understand Thai. Humbly, I say it. Please help me to do more work about them. Thank you so much.
So thank you very much for this presentation and overview of the health issue, or some health issue, right, related. I think there is much more, including sudden death, another issue, but maybe it's coming out from the floor, so I open for people here to ask questions, comments, as well as if there are online, it's being broadcast on Facebook, whether indeed there are questions or comments. Please, we will take 2 or 3 questions and then continue. Yes, please.
I might start. thank you for this talk.
Please introduce yourself.
Yes, I will. Thank you for this talk. Yeah, my name is Nicola. I'm based here in Thailand. I lead a foundation here in Thailand. And one of the projects we run is a non-profit health insurance for illegal workers in Thailand. The question I have for you is, number one, do you have data on utilization of those healthcare services? Do you have data that show that, well, despite health insurance, either there are no health problems, really, or your talk suggests there are health problems, but they do not utilize healthcare services? So that's one. Second, from this situation description, what do you think, besides this research, are the sort of key intervention that should be done to improve, for example, access to services or the whole situation? What are the big loopholes that you identify should be addressed? Thank you.
We'll see if there is other question. Please.
Pressure. It's all kind of sinking in. I also do research in Taiwan and South Korea, and I have to say some of these issues happen also in other countries, and also in Thailand with regard to migrant workers here. These psychotic episodes that are drug related, it's a coping mechanism, of course. Sudden sleeping death that comes from the previous night of over drinking. Things that, the loneliness and things like that. But I was wondering about, do you have a sense of the BLA with regard to the Thai government response to some of these issues? Because now, Thailand has set up in the northeastern provinces direct sending mechanisms in place to Israel. So I'm wondering, what is the Thai government's response to some of these very serious issues? And also, what are the existing or maybe future mental health programs and outreach services that are in existence? And I can't help but thinking that Palestinians also suffered these, so maybe they're not taking amphetamines the way that Thais do, but there's some, amphetamines are taken not only for depression, but so you can keep on working and you don't have to sleep. Right? So there's also some other aspects of that spectrum that I'd just like to hear more about. Thanks.
Any other? Just no? Oh, here, one more.
Thanks.
Introduce yourself.
My name is Julie Shah. I'm also a researcher based here. I work on malaria with the Thai Ministry of Public Health. And in my work, we're mostly talking about Thailand as a receiving country for labor. So I was very drawn to this talk and also surprised to learn that 50% of foreign workers in Israel are Thai. And I have a very basic question. Just could you help me understand a little more what the incentives are for Thai workers to go to Israel? I think it's like kind of before the start of your presentation, it's more background understanding for just how those dynamics started and how long people stay, and just a little more around the narrative of that migration. Thanks.
I think already quite a lot of interesting questions.
Quite a lot. I will start with the Palestinian. That was a very good question. First of all, I have to say that I'm not a researcher of Palestinian issues, but some of my best friends are. And it's very different because they commute. They do go back home for a short time because they come very early in the morning and leave quite late in the evening. But still, they stay at home, and also weekends. And that's a very big thing which changed. And they have it's a whole other set of issues, mostly money issues. But I think the crucial thing about the commute and about supervision and about the way, actually most of them work really next to the West Bank areas, and they have transportation for that. So actually they do have resources of communicate with other people. So the whole issue of loneliness is not working here. And that's a crucial thing, but I will be happy to send you some works on Palestinian agriculture. And I have to say that the big research that I'm going to conduct, I hope to conduct, I just applied for a lot of money to do that. Hopefully I will receive it. It's also about Palestinians, 100%. But the thing with the BLA, actually, I just thought, talking with my girl, about the random system in the BLA. The BLA was, before that they pay a lot of money to come to Israel as recruitment fees, and when they sign a bilateral agreement, they reduce the fees, and one of the things to make sure that the recruitment companies will not take more money was the random system. And I just thought, speaking with my child, that I have to write an article and I have to try to, I would say, to protest against, but I don't think any help will come now from the government about the failure of the random system. Because one of the issues that before the bilateral agreement, people could have come with friends from one village, with not spouses, because that's illegal, but they could have divorced before and then come as spouses together, or brother and sister, and couples, or people who know each other, and then they have those little communities, and which was also about disciplining one another in the bad sense, but also in the good sense, not doing drugs, not feeling so alone, and trying to make, on those days we saw more issues of, community, just community. We both know, of course, Shahar Sham, who's you as well, of course, who studied that more in her PhD. So actually, the random system was destroying all of that. Now, the Thai workers tried to avoid it by coming to Israel with the random system and then changing employer. But they could not do it so easily, and it's not working in the same way. So maybe we need to think again about this puzzle in the bilateral agreement. Just my thought about that. I would say about the insurance a few words. That I think that it's not the question about the insurance. Insurance is limited, but it's working for the state. I'm very interested now about problems of health problems that come after the return. This is one of the reasons I'm looking for a co-researcher to check it here, because I think most of the problems will come a few years after, obviously. I mean, you are in danger of pesticides, and you are in a lack of health. It will only be seen a few years after that. But most of the workers are able to receive medical treatment if the employer and the company will give it to them. It's not the same issues as refugees. I try to compare it to refugees in Israel, horrible situation, and they only have the free clinics to receive. But migrant workers will not have this problem. I know, even a migrant worker from Thailand who are not legally, because he changed employer and not reported about it, the moment he will be found, he can ask for being legal and he will receive it. And the moment he is legal again, he will receive his health insurance. It's not about that. It's about all the obstacles in implement this insurance. A little bit about background. It's more than 40 years. That's a lot. And we are migrant scholars, and we know that there are things about family decisions, about going and about remittances, and we saw it in Isan mostly as an area, international, and I will happy to send you some work about that. Did I get everyone?
But I think you were perhaps asking about the incentive.
The incentive.
The incentive, is that right? I mean, this intrigued me as well.
The money?
Yes. How much do they make?
It has to offset $10,000, so that's a lot in baht. So if 5 years would have to offset $10,000 in the past and $2,500.
In the past, it took them a year and a half to get back all the loans and all the money. A year and a half, and still it was 3.5 years. About that's a tell me about that's a death. That's a funding death, 100%. The TAP trafficking person report from the United States State Department said it's human trafficking. But the regular agreement stopped that, and now it's $2,500, which is a lot of money for me as well, obviously. But now it takes them a month and a half to return it. They get quite a lot of money in means of Israeli money compared to baht. What is the average salary? 7,000 shekels, which is how much baht? You know. 7,000 baht per month. 70,000?
That's more.
70.
Oh,
70.
70.
No. 7,000 shekels are. Yeah, 7,000. 70,000. Yes, 70,000 baht.
So yes, it's even more than my salary in my own university. But so yes, that
It's
is
not
a
mine.
very good stuff.
It's getting a little less, it's getting a little more, but we're talking about 5 shekels, something like that. But this is the areas. Yeah, the center is money, 100% the center is money, obviously.
Is there active recruiting in Isan?
Yes, of course, from the government. The IOM was taking order of that for a few years, and now it's directly from the government. And you asked, of course, your brilliant question. Nothing. I'm sorry. From what my perspective only, and as I say, only Thai people understand Thai, and I don't know anything about Thai politics. But from my perspective of what I read in the regulation and in the protocols sent by Israeli politicians, Thai government only wants this bilateral agreement to continue working. They have 2% deny people from the applying, so that's nothing. That's mainly nothing. So everybody who wants to go, they send in. So, and Israel is always trying to threat by opening the sky to more countries for the agriculture migrant workers, but Thailand says, no, we will give you all the workers you need. And now, when Israel is such a mess politically, they open the quota for 1,500 more people. And I just spoke with you that in the COVID time, when the sky was closed and there was a deficit of worker, the bargaining power was raised. And the conditions was a little bit better because less worker, more competition about the free market, maybe a little bit. But now they're going to bring more. So more workers, less bargaining power, more harsh conditions.
Can you talk more about the trade unionism and inclusion of Thai workers?
Please, can you repeat? Yeah, to be sure.
Can you talk about the inclusion of Thai workers in trade unionism?
I wanted to speak about. I would like to speak about it, but I don't know a lot, and what I know is that it's not happening. So I know there was a few attempts. Of course, I was involved with them. And in the group in TrafLab, but it's the labor approach of human trafficking that I was with in the last 5 years, we tried to do that, and it didn't work. And it didn't work also in Kablo Oven, it didn't work in Ma'an and for Palestine. And there was another attempt in Koch Lavdim, all those, never mind, NGOs project. And it didn't work, I think, mostly because they really are temporary for 5 years. And do not stay in, like, I mean, for the caregiver, the home caregiver, it was a little bit success, but there they are staying for 7, 10 years. And so I cannot say more because there isn't anything to say about. There were a few strikes. There were. But it was only in really, really harsh conditions, mostly about salaries, actually. And the last strike I remember was in my area, And that's when the Thai workers heard that in another settlements they're paying more per hour. And they stopped work until they were comparing down. Now, I have to say, the minimum wage is obligated for everyone. Thai workers and Israeli workers, all the same. And of course, Thai workers get the minimum wage. This bargaining power was about just applying the law.
If I may, in practice, how are they paid?
How do they pay?
Yeah, how are they paid?
Bank transfer.
Right, okay, so this is a bank
Yeah,
transfer, this
they
is
have to
not
do bank
cash.
transfer. They are allowed to give 20% of this. I asked my daughter because she's a farmer as well, and she's working next. I have to say, Amala, I want to introduce herself. This is Amala. She's 15 years old, and she's in school, obviously, but also in the days off, she works in the farm with the cows and with the cows mostly, and she works next to a Thai worker or some and other workers, and she gets a little less than the Thai worker. Yeah, 2 shekels less. Yeah, which is 20 baht less than a Thai worker, and it's so she knows all the legal obligation, and they get.
330 baht.
They can get 20% of their money in cash. Because it's very hard for them also to go to the city to withdraw. There are not ATMs in the settlement, not for me, not for them. So it's allowed to give to everyone actually in Israel 20% of their salary, and Israeli salaries is paid one month. And they have to be transferred through the bank. It's obligated in the day they arrive.
Yeah. It's quite interesting because, I mean, for many workers, migrant workers in Thailand, many are unregistered, in other words, illegal, it means unbanked as well. So that's a quite different situation. It's interesting, thank you.
But do they have to pay anything for living costs, food, and because I think the employer may charge some of these expenses?
First of all, yes. 100% yes. This is one of the. I think now actually I feel actually now that the bilateral agreement is starting to fail, and the recruitment the money to the recruitment companies are starting to raise because of all those fees for transportation between employers and stuff like that. Changing employer, they charge money for that. It's absolutely forbidden, of course. But from the farmer, legally it's not forbidden. It's not very common. I didn't hear about it in any of the survey, but it's legally okay to conduct 25% from the worker's salary for gas, water, electricity, accommodation, rent. This is a lot less than it's actually a cost. So I'm not familiar much. There are horrible employers, I will be the first to say. Horrible people who employ workers, and some of the most horrible issues like drinking will come from a specific farmer. But it's not in the way of deducting money from. It's about not paying minimum wage. You don't need to go and to find other reasons when you just don't pay the amount you should pay. So why to invent?
You say about if they're sick, then they don't get paid for that day. So it seems like day wage, but then it's a monthly wage. So how does it work?
It's not a monthly wage. You get your pay. I'm sorry, maybe I confused it. You get your pay once a month. That's the Israeli system. In the state it's once a week. In Israel it's once a month. But they work hourly. They need to, the legal way is to write the hours, to put your finger on a meter or to put the car, whatever, and you get hourly. You get after 8 hours, it's overtime, and if you work on 7 days, which is absolutely forbidden, you should get, they have 36 hours of rest. They have to get it. But if you can work once in a while, you can work on your day off and you get paid double. But here we see the huge amounts of not paying the amount it should be. So it's still the money is quite large. Even if for us scholars, we say 100%, they do not get what they deserve. 100%. They don't get the overtime payment right, they don't get the sick days, they don't get the pension, they should get the pension. They do not get, once a year you get some money for health, I don't know exactly, by the way. They don't get the minimum wage, exactly. But still, the money is quite high, so the intensity is still in work.
Yeah, maybe to add to the incentive, I think the migration flows, right? It's like migrants from Laos, Cambodia, and they're coming to Thailand, and Thai are going to the Middle East or to East Asia, so where they can make more money than what they would make here in the construction or similar agriculture, etc. So that is the commodification that we are talking about. So the incentive is quite strong compared to what they could get here, and this is why you need then other migrants from neighboring countries, which have much lower salary in their own country. Yeah, so that is a very clear trend at the regional level as well as. So, but again, any other questions and related to, yes?
I'm Liam from Myanmar. After listening to your presentation, I feel like many migrants from Myanmar are working in Thailand, but I think they are worse than Thai migrant workers who work in Israel. They have no proper insurance as well in Thailand. I just I'm wondering, like, did you present your finding to like politicians in your country?
So many times.
So, or what would you like to suggest for the people who would like to go to your country? For example, like if migrants worker would like to go to Korea, they have to learn Korean language, so they can know what is written in the contract, or they can know what is written in the document. But Thai worker, they cannot read Hebrew.
The contract is in Thai as well, legally, but they
But
don't have
in
the time to read it.
Israel,
It's
yeah?
not, it's in here. In here, I have to say that the bilateral agreement brought to us a little bit more constructed, fair way of people to come before they arrive. They come to Bangkok, they get an orientation. I missed the orientation this time, but I was in one 10 years ago. But I know they are still happening, and they get brochures with their rights and with the contracts also translated to Thai. But they do not read it. It doesn't matter, even if they read it. And if they understand it, it will not match reality. Because what happened here, before they come, does not match reality. Now, this specific government, I do not play along. And I do not go to any parliament sessions because I do not support the parliament now. In Israel, I protest against it 100%. But in the former parliament, I was like an everyday session about Thai workers, and a lot of petitions and a lot of reports specifically, and letters in all different issues. And sometimes I can say sometimes things are changing. I know for women we made a regulation, we helped to make a regulation that women can have their own accommodation, which is like, oh my God, I can't believe I need to fight for this shit. So sorry my language, but like, okay. But now it's in the regulation, more or less, and we're trying to change. But I do not see, and I also wrote it to the Thai government about the conditions.
Did they respond?
Ethically, I cannot answer you. I'm obliged to the ethics committee, but I believe the Thai government is hopeless, yes. It's helping this issue. But I do have one idea about helping workers, which we try to organize, and that's about the well-being. I know it's nothing. It's everything is like, just putting your hand, your finger in the water, and anything like that. But I'm trying to promote a line, emotional support through line in the telephone, will be maybe from a social worker or a psychologist here in China, which people can talk with them. And I'm trying to promote it through the embassy, the Thai embassy in Israel. I know it's nothing, but maybe someone can talk with someone. And I hope this government will and then the new government will be a little bit more approachable to issues of well-being and about all kinds of other issues. So we try.
This is because the insurance for migrant worker in principle is that, yeah, there is a migrant health insurance card. So in principle it's there. It didn't work at all during COVID. Many could not access those protections, but in principle those who are under the Memorandum of Understanding, which is a minority of the migrants that are here in Thailand, are also covered by the migrant card, health card, I think, of the Ministry of Health. But the question is again whether it worked out in practice or not, because there are barriers, language barriers, fears if they are irregular, that they may be, because in principle even the irregular could be covered.
Not much irregular workers in Israel.
No, here in Thailand, in principle, but they are afraid to go because then they can be, or the children can be the same. They could go to school, but then they are. So there are all these barriers too, which is a little bit worse what you have there. And also here, if they don't work, they would lose the wage. So it's on the Yaba, I think what was said by Ajahn Musikawong is, I think a good, because you work more. You take Yaba, you work more, you can work extra hours. I think this is happening also here with canteen rank, or this, the bank, the product. You drink a lot and then the Red Bull, which then is overused, can be also very dangerous from an health perspective. And that you do a lot of extra hours. So it's not only the being alone necessarily. I think it's good to investigate that part. But okay, so it's a topic I am also very interested. So this is why I don't do only the moderating.
I would just say, when I said about Yaba, it's absolutely right, and I said it in the parliament in one session, that one of the reasons that they take this Yaba is that they can work more. And they shouted at me, it's so hard. And they said, no, they work hard because they work their money. And I said, like, okay, but you cannot unconnect the reasons for that. And they said,
how they do the Yaba? I mean, how, if they are so isolated, is not to start the trafficking of drugs to Israel, but I mean, how do they get
it?
it?
Came through the mail. Mail, box mail. Sent to Israel. There is in the beginning, the Yaba is in Israel more than 15 years, I think. Yeah, 15 years. I need to see the exact date, more or less. But back then, I was already a scholar for time workers, and we talked with the police, and I asked for their response, official response. What will happen what are you going to do with Yaba? There are drugs. We know that the time workers use a specific drug, which is not common in Israel. I mean, in gay clubs, they do crystal meth, which is a little bit different. It's the same drug, but it's a little bit different. And they told me it's a Thai issue. It's the migrant issue. It will not pass to Israelis. Bullshit, can I say also? I mean, of course, obviously, it didn't stay. I mean, the police was just about, it's their issues. We do not touch it. Now it's a different tone. Now it's different. 15 years later, it's a different tone. But still, there are arrests in the text, you know, in the ships where they check the containers and stuff, because it's been sent. Originally, it's been sent from Thailand, from other places. But of course, we have quite a lot of drug dealers from Taiwan. As we see some parts which is a worker come and immediately leave his employer and doesn't contact any employers in any other place, and then arrested by the government. And now in the Israeli jail, actually, there are a few workers who are as drug dealers. Better conditions than the Thai jails, but still.
Very, very interesting all this, but we are not going to ask more about but maybe I'll ask a question about this sudden death. If you know anything about this, because it seems to be related to Thai worker in particular, also in other countries, Singapore, and so can you tell us anything about?
You are the expert. You are, not me. But I know, where is it? I think it's in my second slide. Over here. No, it's in another death trauma. No, it's about natural death. Yeah, there is a continuation of this table about death, natural death, and then there's the sudden death, which happens not in the familiar amounts, but 3 to 5, I think, every year, which is a lot, again, because we're talking about healthy young people, all exempt by health examiner before they come to Israel. And I know in Israel they are do not try to make surgeries after that, and the embassy do not encourage that. It's hard to contact the families. Israel is also a Jewish, white religion country, actually, in its way of ideas, so to do those tests for another people. So actually Israel is just about, we don't care, we don't mind, it's their problem. I mean, I talk about officially politics, way for us to do care about it. But it's like, you have the syndrome, you have those beliefs, and if someone will talk, and I will talk to officials, and they say, oh, it's the drugs. It's because of the drugs. Now it can be also because of all those, health conditions, and drugs, and drinking, and genetic, and whatever. But Israel does not pay attention to that. I think 5 governments ago, there were one politician he said like, no, we have to deal with this issue. We bring people, and they just don't wake up in the morning. But Israel government was changing, and this person is not in the government anymore.
I think also in Singapore there is more attention now for people.
It is. I did it like not very, not very well. Yeah, this is natural death. Oh, look at the numbers. Yeah. That's quite a lot of numbers. But it's also for cancer. It's not only death, not just waking up. It's also cancer, diarrhea, and stuff like that. That's quite a lot as well for a young, healthy people.
Related to environmental.
Oh, absolutely.
Okay, so quite worrisome still, and so I think the research you are going to do is very important, and we hope to hear more as you are further down the line, and you hopefully come back again to tell us more and share the results of. So thank you very much for an applause to our speaker, and he has some food so we can continue the discussion about with coffee and tea, and also please give a donation on your way out, as it's a way to help.
Also Israeli delicacies.
Oh,
what's
yes,
also,
also, yeah. Luckily the author also contributed. Yes, she brought some food, which is particular of Israel. So please do enjoy. Thank you again.